This is Hugh in Hyperion. California announced a new round of stay-at-home orders prohibiting private gatherings. Some particular facilities are to shut. The New York Times called it shutdown, strongest virus measure since the spring. This is a bitter but compelling choice for California, who has a developed economy and the largest population in the United States. Governor Gavin Newsom indicated that 4 of the 5 regions in California would be under the 50% ICU threshold by early this month, and the ICU beds would be at 112% capacity by mid-December.
The bottom line is, if we don't act now, our hospital system will be overwhelmed.
NBC noted that on December the 2nd, the U.S. has set 3 green records, recording the highest number of daily deaths, new infections, and hospitalizations since the pandemic began. In such critical situation, the medical system crisis is just a miniature.
90% of our hospitals in this nation are actually in what we call one of the hot zones, in the red zones. 90% of all of our long-term care facilities now are in what we call high transmission zones.
New Mexico's 534 intensive care beds were at 101% of capacity on Tuesday, according to HHS. The Guardian on 2nd believed that coronavirus surge ravages small rural hospitals. States could choose to build more hospitals, yes, but the bottleneck is more about the hospitalization, the treatment. Troy Clark, president and CEO of New Mexico Hospital Association, said to USA Today that while there may be physical beds, there is not a nurse tech, or a therapist to care for those patients. That's what we are suppressed. USA Today also mentioned now in North Dakota, they have allowed staff who test positive but show no symptoms to keep working. A patient carrying a patient, which is qualified to be called a tragic. Another tragedy is about an ICU nurse in Oklahoma City who lost her husband and mom with her son infected.
You know, sometimes I'm grieving for my husband and then I realize my mom's gone. You know, they're both gone.
I couldn't come hug my mom because I couldn't get her sick.
There was a chaos in spring that many states battled for supplies. Now it became a scramble for recruiting. AP reported that U.S. hospitals are trying to lure nurses and doctors out of retirement, recruiting students who have yet to earn their licenses. Salaries for nurses who travel from state to state is as high as $6,200 per week, but still, there are now 1,000 openings for travel nurses.
But the reality is, December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
CDC Director Robert Redfield predicted that total deaths for the COVID could reach close to 450,000. This is indeed a humanitarian disaster. With the best medical level, best equipment, why the US cannot win the battle and just keep retreating and retreat and retreat? This is the city, the issue. Incoming Washington team need to rack their brains and rack with pain.